Welcome, everyone, to the Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy counselor, and I'm joined today with the very leg lifting Dr. Jason Martin, MD.
One of my favorite things to do is lift legs.
I know. You got them. You got those gains.
I got those lifting legs feelings in the OR. Today we're talking about thighplasty, thigh lift, leg lift. How many times do people come in and complain about their thighs?
Well, I would say it's pretty universal for most women after the age of
females,
40 who grab the front of their thighs aggressively and pull straight up. Like, that's a thing.
Above their knees, the inner thighs, at the lower, underneath their butt, at the what we call the posterior thighs, that area. It's a problem.
Yes, gravity is not kind to the thighs.
Especially to people with fair skin. They get loose skin. It's fairly universal. So what we're going to talk about today is a thigh lift or a thighplasty or a leg lift or different names. And there's different versions of this. But these are the type of surgeries that will solve this problem. But Amy, does everyone need a thigh lift?
No. And we'll kind of talk about who is a good candidate for different variations of thigh lift. We do have a couple of slides that go along with this episode, so if you are interested in seeing those, you can always check us out on our YouTube channel at Jason Martin MD, and also on Instagram at Beauty and the Surgeon Podcast, where we share some of those as well. But we'll do our best to describe them, and this one I think we will do a fairly decent job at that. This is not the what color is this cannula question, so I think we'll be okay.
The body tight, 1970s Tupperware? Okay.
Yes.
As we always start out, most of our episodes, there's tends to be a flow that we have. And Amy is the stats lady, and she always gives it the stats. So that's what we're going to start out with today.
Yes, and this is great because we do now have the statistical data from the American Society of Plastic Surgeons for 2018 to look at. And it's pretty cool because they always show the year before in comparison, but they also show the data from when they first started tracking this back in the year 2000 and the percentage change. And this one's really cool because the percentage of increase in thigh lifts since 2000 to 2018 is 90%.
Why do you think that is?
I think it's a lot of reasons. I think that in that time frame, types of weight loss surgery have perhaps become more common.
You always steal my thunder.
Well, you asked. If you don't want me to say it, you got to keep it to yourself.
So when I ask fellows questions like that, they always say the wrong answer, and it's, I make them feel terrible. But you always get the right answer. It's annoying. So I think bariatric surgery or weight loss surgery is a big reason for that.
Yeah, and also refinement of the techniques of thigh lifts. I mean, we'll talk about the different types, and the type of thigh lift that we do most frequently now is the medial thigh lift, and it's definitely a lot less involved than thigh lifts back in the 2000s that were the full thigh lift that were really involved.
Which is an incision on the inside of your leg from your knee up to your genitals, basically.
Yeah. So I think that all comes into play. I mean, as techniques improve and there are more options, better options for some people, less invasive options, of course, those numbers do go up, but it's a pretty amazing increase that in 18 years we had an increase of 90% of this type of surgery.
Still, the number's low. So we did an episode recently on face and neck lifts, and that number was around 150,000 a year, and these are 10,000 a year.
Yeah, 10,100. Who was that person who changed it from being 10,099 to 10,100?
It's like the golden ticket.
Yes. Like I was the 100.
Yeah, I was the 10,100
Yes.
patient of that year. And do you think that was done like on New Year's Eve?
Maybe. Like we got to get one more in. Like I know your surgery scheduled for January 1st, but we got data.
No, we want to be. we want to get this. Be the last person. So basically, if you're someone who struggles with loose skin and fat you don't like on your lower extremities, on your legs, specifically between your knee and your butt, and that could be on the front of your leg or the back of your leg. In most cases, the answer is going to be liposuction, preferably with something that has energy. Like we use something called Body Tight. There's a good episode on that. You can look back on that. We used to use Smart Lipo. We've used Vaser, something to contour the thighs and tighten the skin at the same time. There are external treatments that are really good. You can go to a dermatology office and they'll have at least 2 of them. And they're going to tell you they're going to tighten the skin and make it great. They're going to make the skin at the most 10% tighter, if that. But they'll have an effect, so that's good. And you also have external fat treatments like cool sculpting, which is not Amy's favorite, but it does work, especially in the inner thigh. So contouring of the thighs and even tightening of the skin can be done without a thigh lift. A majority of people will be candidates for that. But if you're someone who needs a thigh lift, and we'll probably go into the indications on that, the two basic types of thigh lift are a medial thigh lift, or the thigh lift where the incision is along the crease between your leg and your genital area. That's called the perineum. You have either vagina, penis, and then it goes back to the perineum and along the gluteal crease, the crease where your butt meets your leg. I'm sorry, I'm really struggling to say this in normal person terms. Can you say it better?
Oh my gosh, so the movie The Story of Us, there's a great scene where two men are having a discussion about, there's going to be a bit of swearing in this episode right now. Like, what is the ass? It's just the top of the thighs. and at one point in another part of the movie, there's a heated argument and he tells him to shove it up the top of his thighs. So really, what is the butt but the top of the thighs? So, that crease, I think everybody kind of understands.
And you follow that all the way around to the
Correct.
front. To the front.
Or
yeah.
to the side. I mean,
Yeah.
we tend not to go to the front, obviously, but definitely to the side.
But a medial thigh lift, you'll go up into the crease that goes almost next to your pubic hair.
Yes, you mean
Yeah.
coming up on that medial. I was talking about the lateral part of the incision.
So I guess we are
Yeah.
struggling a little bit to describe it. If you look on our YouTube channel, you'll see it. But the medial thigh lift really addresses the inner thighs.
Yeah, the upper third of the thigh
And at the most, a half.
at the very most.
Sometimes we'll do an extended medial thigh lift, which will do the upper third in a horizontal fashion and then also extend it down the leg, sometimes to the knee, to do the thigh circumferentially and tighten it that way.
And that really is, unfortunately, the only way for someone who has a lot of redundancy or a lot of loose skin on the lower third of their leg, stuff that hangs over your knee. It's really bad. Like, the only way to really get at that is to pull it, because your leg is it's a cylinder. So making that incision all the way down to the end point of where the problem kind of ends, just like when we talked about with brachioplasty on our brachioplasty episode, that incision needs to go the length of the arm, just like it would need to go the length of the leg if you're trying to address the length of the leg.
Exactly right.
Because you can't pull up on a cylinder. You can't like make an incision just around the top of the thigh and just pull straight up like a sock.
And I think brachioplasty is a really good equivalent to this, because you're talking about an extremity of some sort, and you have to, if it's bad enough, you have to treat it circumferentially.
Yeah.
And the only way to do that is put an incision from the knee up to your butt area. So also, a thigh lift can be done with a body lift, which are incisions up near your hip, and those will definitely address the butt, the thighs, both in the front and the back. That's an extreme surgery. We're not really going to talk about that today as much, because that's a whole separate episode on body lifting. If you look on our YouTube channel, there's a spiral thigh lift, which kind of does a body lift that kind of rotates down into a medial thigh lift, for what that's worth. With that said, body lifting is a great surgery, but it's really useful for people post-weight loss, probably greater than 50 pounds, most like 70, 100 pounds. Those people with severe skin looseness of the lower extremities, the body lift is going to solve that problem. So if we're thinking about a thigh lift, you really got two options, main options. It's going to be a medial thigh lift, or the inner thighs, and that's going to be the upper half of the inner thighs. Or you're going to do what we're calling an extended medial thigh lift, which is really the formal old school thigh lift, which is an incision that goes from the knee up to your butt. Now, the extended medial thigh lift also it makes it almost like a hockey stick that goes up into your groin, and that's a little bit harder to describe. But these are all variations of a linear scar that goes from your knee up to your butt. In most cases, for people that come in our office, and again, we are in Colorado, so you don't have maybe as much of an epidemic of obesity, then subsequent weight loss surgery or weight loss clinics that really focus on this. In our clinic, most of the time we're doing medial thigh lifts. And I would assume that's probably true in most places.
Yeah, and I think that a lot of that has to do with same thing with a brachioplasty, and you're trading a big problem for a scar. Now, it's a definitive solution, but it does come with the trade-off of a scar. And specifically, we'll talk more about this, the real special considerations with this surgery specifically. But if you're going to be really self-conscious of that scar, more self-conscious than you are of the skin, you kind of need to work through that. And it's the same thing with the arms. I think most patients who do a full brachioplasty, absolutely wear short sleeve shirts again because that scar does fade. Same thing with people who do an extended thigh lift are going to wear shorts again, even though that scar might be visible in some situations. You have to remember that the parts of the scar that are visible are on the very inner part of your leg. So there are rare times when someone's really going to see that without really, really looking for it, even if you're wearing shorts. I mean, if you're standing up, you can't see it. If you're walking, hopefully somebody's not like staring down at the inside of your legs while you're walking. Same thing when you're sitting. Like,
what would you do if someone was just staring at your legs while you were walking? I mean, I guess that's like every woman, what they have to deal with in real life.
But when you're looking at a person's legs when they're walking,
that would be very disturbing to me.
Right, you're looking at their leg. You're not looking at you're not trying to look at their inner knee. You're looking at their leg and the aesthetics. So
yeah, I mean, I think it depends on you as a patient, and also your self-perception, and also the severity of your presentation.
Yes,
there's certain people that I'll just tell them, like, you need to do the extended incision. I know that it's frustrating to know that you'll have a scar on your legs, but having a scar on your leg is way better than having what you're dealing with right now. And I would say 99 times out of 100, they're like, okay, I agree with you. They already know that before they come in.
Yeah.
Because they're touching their legs and they're looking on Google and they're figuring it out. They're like, there's no way that a medial thigh lift's going to work for me. The ones you feel bad for are the ones that are past the midpoint and actually need the extended, but you can't get them into that territory because they're like, ugh, I just don't know if I can do that.
And that's okay.
And usually those people wait.
Yeah. And that's really where, with all plastic surgery and cosmetic procedures, it's really important that you do come at these from a really good mindset. If this is not, like, if you don't want a scar, like, this is not surgery for you, and that's fine. Like, you are fine the way you are. So
you are fine.
You are absolutely fine the way you are.
Yeah.
If you want to fix it, this is how you do it.
But a lot of people come in, they want to wear shorts, and sometimes if you really want to wear shorts and feel like you can show off your legs, I mean, we got to call a spade a spade. And if you have a lot of redundancy of skin there that really, really bothers you from a being self-conscious standpoint, then the only way around it is truly a thigh lift.
It's true.
Yeah.
At the same time,
you don't have to do it.
No. And if you're considering this, think about this. There are a lot of women who come in our office who are underweight, have been underweight their entire adult life, and come in and tell me they refuse to wear shorts. And these are women who are literally a third of my size, and say that they won't wear shorts because they don't like the way their knee looks. Like, it's hideous. They can't go outside like this. And I am here to tell a woman.
She sounds like she's hating a little bit.
I'm not hating. I'm loving, because no matter what your size, I guarantee you that no one in this room would walk up to a person on the street and say, you should not be wearing shorts.
Right.
Like, you live your life.
And also, a part of this too, especially for those skinny ladies that come in and do the whole thing that you're talking about, and you and I both do the 3 snaps. I know it. But also, there's a part of this where you have to try on your own. For someone who has a lot of redundancy or loose skin, our heart breaks for you. Like, it's hard to get around that. But for someone who's skinnier but has some loose skin, you got to get into the gym. You got to try to increase muscle mass. You got to tone up. You got to do everything you can on your own to make your legs look as good as possible.
Yeah.
And some of those patients that come in, they don't do any lower extremity workouts at all because they're worried about making their legs bigger.
Right.
They're already super skinny to start with. It can only help.
Because bulking up is such a concern for women. Like, good luck with that, ladies. Like, I'd like to know how that goes, putting on lots of muscle
Which
mass.
we've mentioned this multiple times before, but, like, it's impossible to bulk up even for, like, a guy with testosterone. I mean, it takes a lot of work. So if you're a woman and assuming that you have estrogen floating around, it's going to be very hard for you to bulk up. But, toning up would be good. And, trying to put a little bit of muscle mass on would be good,
yes,
from my perspective.
And why that's good is because that helps strengthen those fascial bonds between the skin and the underlying musculature. If you kind of think about it.
Why is that? So what we've talked about before, superficial fascial system is the word we use. If you look that up, you'll probably get a name, Ted Lockwood. He was a Kansas City plastic surgeon, and he described this. And there's a whole layer between the muscle and the skin that, like, kind of keeps your soft tissue together, and that system can get stretched out over time with age, with obesity, with pregnancy, swelling. Women have a tendency to swell more because of their cycles, hormonal cycles, obviously. So the attachments specifically, you'll see in the areas where you have a lot of looseness, are not as prominent, or they get stretched out more easily there. The arms, the breast, the inner thighs, above the knees. These areas obviously are different than other areas of your body that don't get as stretched out as much. So why would gaining muscle, I'm getting back to what the question I was asking you, I'm sorry. Why would gaining muscle help those attachments?
For a couple of reasons. I mean, for one, it's helping just strengthen the bond. Like when you're encouraging muscle growth, it's helping it's bringing stimulus to that area.
Gotcha. Okay.
So it's stimulating that area, and also it's firming up that muscle underneath, which is going to, by default, I mean, think about if you have, let's say like you have 2 blankets laying on top of each other. They're both soft. They look soft and hanging. Whereas if you put a blanket on top of concrete, the blanket looks less wrinkly and flat. And that's what's happening. You're building up that underneath structure, making it tighter.
We're going to do a YouTube video about 2 blankets.
Well, I was trying to think 2 soft things. I'm like, oh, like Jell-O and whipped cream. Like, I don't know,
I don't know where you pull this stuff out of. I mean, I'm sitting here saying all these medical words, and everyone's like, Martin sucks. But
it's a deep, dark hole back there.
2 blankets. That's what the article on the websites could be called 2 blankets.
2 blankets.
Yeah.
Well, I think anyway. I mean, think about it, like you throw a blanket over a rock, it definitely, or a towel over a rock. Let's say it looks a lot different than if you throw a towel over a pillow.
That's a huge point. Most women struggle with their thigh contour. You're not alone, and it's not. In most cases, besides cellulite, and that's a whole separate podcast or episode, and we will discuss that at some point. But when you're talking about contour of your thighs, both with loose skin and fat, it's like a majority of women that are out there in some form or the other. Now, its severity depends, and it's when you're younger, it's usually a lot better. So in most cases, you don't even need surgery. You really just need to focus on what you're doing for toning and exercise.
And diet. Diet makes a huge
difference.
Huge difference.
And by the way, restrictive diets are not going to always make your legs look better. In some ways, they're going to make them look worse. Mm-hmm. So having someone who's certified in nutrition like Amy help you with your diet, specifically with the goal to make your legs look better, is really smart. Getting a trainer to help you with exercises related to your lower extremities is really important. Me, for example, I was never focused on my lower extremities, and I started to, not because of the contour, even though I do care about my contour.
Were you skipping leg day, Dr.
Yeah, I was skipping leg day a little bit. I hate leg day. I'm going to be very honest with you. I don't like leg day, but I make myself go. Why? Strength in my legs transfers up to my core. When I'm doing surgery, it helps me. I don't have back pain when I get out of surgery now. I feel stronger. I feel more complete as a person. It just makes me feel better. So don't shy away from the exercises, the lower extremities. If you want to go on Instagram or any kind of social media, there's tons of stuff on this. Some of them are salacious and photoshopped. But most of the things is you have to have focus on those muscle groups. All right, so say we have a patient that comes in and they've done all the things they need to do. They did the Brent Contreras lower extremity workout, which is always insane. So who is usually a candidate for this procedure?
So people who have excess skin and fat that is not responsive to other lifestyle changes, or as a result of extreme weight loss, or we had a patient, oh my gosh, years ago that we saw who had terrible edema when she was pregnant, and like really, really bad edema. I don't know if you actually saw this patient. I think it would have been Dr. C's. She was in her 20s, like early 20s, and had just the effects of this. Like she gained like 80 pounds of fluid basically in the course of several days, and then retained it through the rest of her pregnancy for several months. Yeah, like she's probably gonna need that loose skin removed. So someone who has lost a lot of weight, has maybe some genetic stuff going on. We did have that patient who had, what's the condition called where they don't have collagen?
The Ehlers-Danlos?
Yep, remember?
Yeah. We
did brachioplasty and a thigh lift and an abdominoplasty, and she was at a normal weight.
But no, that was not the Ehlers-Danlos patient, that can be problematic for wound healing. I know who you're talking about. I don't remember what condition they had. There are conditions where your soft tissue, the connective tissue is really not great.
Yeah, and that particular patient, like she was at a normal weight her entire life. In fact, she was thin.
Right.
Yeah, so she had never been overweight, but she had skin laxity that was extreme. So that's really an ideal candidate for a person who is a good candidate for a thigh lift. And you've also come to terms with the fact that you're trading out a problem for a scar, which is key. It really is.
And that's why I think the severity of your presentation has to be at least moderate, because you're going to put a scar. And let's talk about where the scars are located.
Well, we'll talk about that I think let's skip to our special considerations
Okay,
slide,
all right.
because there are some very special considerations with the thigh lift that are unique to this surgery. You have a scar very close to your genitalia, and you can't sit
I would
for
like
days.
you to describe where that scar is located, because I struggled at the beginning only because I couldn't say my medical words, and I would like you, Amy, to describe where that scar is located.
So the scar that comes up to the front comes basically, if you were to draw a straight line from where your thigh is going to meet your torso, straight up.
Think Barbie, right? The
Yep.
Barbie doll, like where you have that space where the leg moves. That scar is going to go up to basically where your pubic
To
hair
the
is.
top of where your pubic hair ends.
Maybe not the top of the pubic hair, but yeah.
Close. Well, no one has pubic hair anymore, so it's a non-factor.
That's
where it used to
way
end.
too much information. Of course. Next one. Okay, so we're going to start there.
Next one. So that is a big consideration. And there is, we've had a couple patients in the past who wisely have researched this procedure in detail and
No, but you didn't finish where the scar's going.
No, but I'm getting at
okay.
that.
All right. You're not going to get out of this.
No, I'm for women specifically, right? This incision is coming right by your labia. And if it is not done in the right way, if the incision is not anchored the correct way, it can spread your labia in a way that is really not pleasant.
And the medical word for that is efface your labia, E-F-F-A-C-E, I think.
Yep.
So effacement. And it's really, really not great.
Yep.
It's not good. It can distort the labia. It can be uncomfortable. It can affect the way you wear underwear. It's just...
Swimsuits, it can almost pull the labia down onto a part of the thigh that is exposed if that scar spreads in a way that's not good. So...
And we'll get to that with the surgery.
Yeah.
So you go next to your labia, or a man, you go next to your scrotum, and then where does it go?
So then in most cases, if we're doing a medial thigh lift, it's going to kind of make a turn essentially and follow that gluteal fold where the thigh meets the butt.
And people know that.
Yep.
Where the upper leg, what did that guy call it?
It's just the tops of the legs.
The tops of the legs.
Yep.
Where the tops of the legs, so where the butt meets your thigh, the hamstring area. That's where that crease is, and you would carry the incision through there.
So it's inset there, but there are times when it almost kind of loops around the edge of your hip a little bit, and that's where it's, again, a special consideration. If you like wearing a smaller cut swimsuit bottom, that scar is probably going to stick out the side. Even in some boy short cut bikini or swimsuit bottoms or swimsuits, like it can still potentially show a little bit in certain situations. Now, again, if you're standing upright, those probably are not going to be a problem. But if you're bending over and someone's looking at you from behind, they may see that scar kind of sneaking out the side.
You have this leering guy looking at these people all the time.
Like, oh my gosh, somebody's gonna see it. I'm like, well, they have to be looking for it, and then know, and then what?
Right, but
care.
There is a conceivable situation that you would have this surgery, have a bathing suit on, bend over to grab something, just there with your family.
And someone says, oh my God, what happened to your leg?
What happened to your leg? Why do you have a scar on your butt crease?
Correct.
Yeah.
So that's something to consider. And also, because we are pulling up on that area, there's a lot of tension on that incision, and we don't want you to bend your legs for quite some time.
This is the hard thing.
Yeah, like you're going to spend the next 4 weeks of your life with a toilet extender standing up.
I mean, if you do this correctly, you can't really sit down completely. So you can lay down, you can stand, which doesn't, in most cases, won't really preclude you from doing anything you need to do, but you really can't sit. So where does that really cause a problem? Driving. And then the second thing, which is more important, the toilet seat. So especially for women.
Yeah, so absolutely after this procedure, I recommend everyone get the toilet extender, which are very easy to come by. So get the toilet extender.
I think we talked about previously that we're going to get a toilet extender that we put our logo on it. We're going to sell it through our office.
Well, that's
Jason Martin, MD, toilet extender.
And even really a big consideration for women, again, they make a device that allows women to stand up to pee.
Yep.
And highly, highly recommend that, because this incision is in an area that is going to be warm and moist, and we need it to be dry.
Yeah.
So it needs to be very clean. You also are going to have surgical drains for probably at least 5 to 7 days after your surgery, which means you cannot shower. That area needs to stay clean, clean, clean. So, and it's in an area near fecal matter and other things that we don't want getting near your incision. So it's really important that you keep it very, very clean, which can be a challenge.
It can be a big challenge, especially when you have discomfort and stuff like that.
Yeah, and you're not moving around really well.
So the two big special considerations are the location, and we'll go through we already went through the location of the other scar, but we'll talk about it again. The scar location, Specifically with the medial thigh lift, you can cause effacement of the labia. And theoretically, you could see it in different positions. It's not the standard standing position, but if you really kind of bent over, you had a bathing suit on, theoretically, you could see it, depending on the cut of the bathing suit. The second thing is, which is probably the biggest special consideration, is that it is life-changing for a couple weeks. You cannot really sit.
Can't drive.
Can't drive. It's going to affect your bathroom habits. Clearly, not that this should be a major factor, it's going to affect activities in the bedroom. Anything that works in that area, you're going to have to kind of put that on the down low.
For longer than any other surgery we do.
Yep.
Yeah, like it really is a special consideration. It's not, I mean, a brachioplasty is a very long incision, but you go back to most normal activity in a couple of days without much changing in your habits. You could be driving as soon as you're off pain meds. Like,
because you don't pee out of your armpit.
Correct. And a lot of other and you also,
don't poop out of your armpit.
The sitting, hopefully not. That might be handy. Reroute things after your
I knew a guy when I was a kid who kind of it felt like he pooped out of his armpits. It's terrible. So, that's a special consideration.
And that there could be permanent changes in that area as well, which is always something to consider. So making sure you're going to a doctor who's really comfortable doing this surgery is so key.
Right. This effacement thing, the way that it affects your labia look, which can affect intercourse and can affect its functioning and the way it feels, it's super important. You go to someone who does this on a regular basis. We do this a lot. I say that almost every episode we do. We actually do.
We do a lot of everything.
We do a lot of everything, but we do this procedure a lot. The medial thigh lift mostly, not the longer incision. And I use these special suturing techniques that was, as I mentioned before, Ted Lockwood came up with. Use these permanent sutures. We have a whole kind of system in place for recovery. It's kind of a process, but it works, and our patients are happy, and my outcomes are great, and the scars are not a problem. And they're on their way, and they don't get effaced labia or distorted labia, and they don't have functional problems. So,
but even in the best case scenario with us, I mean, there is still there are going to be things that feel strange for maybe a while. I had a patient who, after a thigh lift for probably 6-8 months, that it felt like that feeling when you have your labia like maybe caught in your bicycle shorts. Like, it's gotten pulled to the side a little bit, and I'm sure men have that same feeling with your scrotum if it's kind of like caught a little bit. Just that kind of nagging sensation. And that is because there's tension there, and that went away and it goes away, but there are extra things to consider with this surgery.
The downtime and recovery and related to the surgery is, we've talked about what occurs during the downtime and recovery, but the downtime and recovery of the surgery is probably longer than almost any surgery we do too.
Besides a body lift.
Besides a body lift. So now talking this out, like, why would anyone do this surgery? It has a terrible scar. The downtime and recovery is terrible. You can't pee, you can't poop, can't have intercourse. Why is anyone doing this? Why is anyone doing this surgery?
Because it's freedom.
It is remarkable.
It is body freedom.
Right. I'm telling you, it's hard to explain, because even if you show people pictures, it's really hard to. There's a tangible tactile component of this. Like when you are someone who has saggy thighs, especially in the inner thighs, you can't wear shorts, you can't wear anything. It's so disastrous in your mind, at least, and you can get rid of that. I mean, the patients are extremely happy,
yeah,
even with all the downtime and recovery.
They are. Yep. And it's just like we said with brachioplasty, it is the definitive solution, and when you're mentally prepared for that, it is absolutely worth all of the challenges of recovery. And you're not immobilized. We encourage you to walk. We insist that you are up moving around after surgery, so you're walking. These sutures come out, the drains come out, the staples come out, you heal, you sit on the toilet again. Like, all these things happen. They just are going to take a little longer. Having a really good support system is, I feel like, the most critical thing with a thigh lift, because you do need a little bit of extra assistance with some daily activities, like walking and making sure you've got somebody there to drive you places and get, to help you out. But it's worth it.
I'm just looking, if you look on our YouTube channel, there's a woman looking up over the sheets. This is Sarah's picture. This is very interesting.
This is not a picture of Sarah. This is the picture she chose to talk about downtime and recovery.
I think it's very funny.
Yeah. She's doing fine. She's recovering.
She's recovering.
Fine.
She just has sheets up over her, so you just want to see anything. It's all good. We're good. So Don't you think we should talk a little bit about the surgery itself?
Mm-hmm.
Yeah. It just FYI, we talked about this before, but the longer extended incision that goes from your knee up to your thigh also gets closed in similar fashion with the similar types of sutures to make sure, because there's going to be a lot of tension there, and you're going to have to take care of it. Mm-hmm. You can't do crazy leg movements. And one of the things after the surgery, people are like, well, I'm not going to walk around and all. You have to walk, because of the risk of blood clots after the surgery is a lot higher. So you have to walk, but you have to walk in a way that you're cognizant of everywhere that we did surgery. Mm-hmm. So in almost all cases of a thigh lift, and that's an extended type or a medial thigh lift or the inner thigh lift, we're going to do liposuction first. And if someone doesn't do liposuction first, it's because you have no fat, and that's few and far between in people with the surgery. It does happen, but in most cases, you're going to do some sort of liposuction. The liposuction allows us to pre-tunnel or pre-elevate the flap before we do anything. In the case of a medial thigh lift, we're going to make the incision exactly where Amy discussed, along the pubic hairline, next to your labia or next to your scrotum, and then into the gluteal crease. There we go. That was easy. Why didn't I? Why did I struggle with that?
There.
Okay, we got there. So we're going to make that incision. We're going to elevate a skin flap. We're not going to go down to we're going to go down to the muscle, but not any deeper. There are nerves and structures around here. We're not going to talk about those today, but those are important. You have to avoid those. And then
large amounts of blood are traveling up our legs.
We're going to elevate a flap, elevate it up, and then we're going to pull. For the case of an inner thigh lift, we're going to pull the skin up towards your head. Take off the excess skin, inset that skin flap, call it a day, put a drain in. In the case of an extended thigh lift, we're going to do the same thing, but also extending that down to your knee. Now, for an extended thigh lift, when you do the vertical incision, you usually don't elevate a flap. And a lot of that has to do with seromas and the structures that are around there. So you'll just kind of do a pinch technique, decide exactly where you need to make your incision. You better hope you do it correctly. Mm-hmm. Make the incision, take out the skin and soft tissue, and then close it up. You'll still do some liposuction there too. In a lot of cases, a lot of your attachments are still attached even when you do a medial thigh lift, and that does help with healing and helps with strength. The attachments from the muscle to the skin. And that's basically it. I mean, it sounds like it's very simple, but the closure part is very, very tedious. It takes me to close a medial thigh lift, it'll take me double the amount of time that it takes me to close a tummy tuck.
Well, it's twice as long.
But it's not even just the length, it's just the amount of layers I put in and the meticulous nature of the closure.
Yeah.
That's why you need to go to someone who actually enjoys doing these procedures, because they're work intensive.
Yeah, they're very
You don't want someone to cut corners on your thigh lift.
No.
I mean, you don't want anyone to cut corners on any lift, but especially on this one, because what the worst case scenario is they don't close it right and you have something called a dehiscence. Afterwards, it pops open. And we've had a few of those. Mm-hmm. Thank God they were small in areas that could be treated just really conservatively, but that can be a real issue.
It can, and that's something that is definitely a consideration, and why it's really important to have your post-op plan really in place before you do a surgery like this, because it is probably more prone to complications than any other procedure we do, for a couple of reasons: the length of the incision, the intensity of the recovery, the length of recovery. This incision takes a long time to heal because it is on constant tension. So it's slower to heal than, say,
an area that tends to be moist. It's an area that tends to rub a lot when you walk.
Kind of can't help it. You're swollen.
Clothes rub up against it.
Everything rubs against it. Like it's a challenging area to heal. And we had a patient who came to us who'd had his thigh lift done out of the country. Great surgery, but he had a dehiscence, and it was, oh my gosh, months of, he had to pack this every single day. Anytime he used the restroom, he had to repack, like basically had to shower and repack this wound for months. So, and we obviously did his care, but we didn't do his surgery. But it's not like his surgery was bad. His surgery was great. And he had a great result in the end. It didn't even need a scar revision. Like, that area does heal well. It just heals slow. Yeah. Sorry, I feel like I'm always the downer. You start talking about things like senescence and cell death and tissue healing.
Well, you talked about longevity. So first we talked about that when you run out of stem cells, you die. And then when we talked about you run out of breaths, you die. Apparently Japanese believe this. What was the other thing you talked about?
Telomeres.
Yeah, you run out of telomeres, you die.
Yep. I'm just the angel of death over here.
Great to go on a date with. Have a glass of wine and just feel terrible about life. And that's really it. In terms of is it who's the candidate? We've already talked about that. You got to at least have a moderate amount of issues. In terms of the recovery, we're not beating around the bush. We're not lying. In terms, it's a tough recovery. The incision's in a place that's uncomfortable. It's not severely painful, but it's definitely annoying. It's annoying as hell.
It's annoying, yeah.
If you go to an office and they tell you, this is great, walk in the park's like nothing. I do these all the time. It's amazing. You're not going to feel anything. We're so amazing. Then they're absolutely 100% lying to you. I mean, I assume no one would do that, but I'm sure there's some office like that.
Maybe.
Yeah. It is not a walk in the park, but man, it's like a marathon. You get done with it. Whew, it's awesome.
Yes, it is. And scars fade, and that's something to always keep in mind with any surgery. Yes, there will be a scar. Yes, it will fade. And what you're trading it for is something that without the scar would not be possible.
We've had people ask questions like, will it be visible in intimate situations? Yes. Okay. And it'll be faded. It won't be very obvious, but if you were went in for a clinical exam with your OBGYN or your urologist, if you're a man, they would be able to locate the fact that you have a scar there. It'll be subtle, but they would locate it.
That's true. I will say this, and I'm obviously going to say that you're an amazing surgeon. You are. We had a patient who had a thigh lift with us not even that long ago, like less than 5 years. So it was not like her scar was really old, and came in for a Votiva treatment with me, which is a vaginal rejuvenation treatment. And I honestly had forgotten entirely that she had the thigh lift. And she said something about it. She's like, something about her scars looking good. And I'm like, oh yeah, from your tummy tuck. She's like, no, from my thigh lift. I'm like, oh my gosh, that's right. And like, I'm right up in there with Votiva. Like it's not, and it's a long time. It's 20 minutes of right up in there. So it fades extremely well.
So you could barely
cases.
see it even with lighting.
Oh, and lighting and, not to be graphic, but like it's bright, legs spread.
Legs spread.
Yeah. So again, if someone is focused on that in that situation, like kick that person out of bed, male or female, with you, because they don't deserve it.
Yeah. I personally avoid those conversations, but that's what goes through my head. I mean, if you wanted to do this and you have lax skin or loose skin and things you don't like, you can fix it, and the scar fades. And Amy was, as quote unquote, all up in there, and she couldn't even see it. And you were with someone and they had a problem with this, then maybe we need to consider our choices of significant others.
Yeah.
Is that what you're saying?
Yeah.
Okay.
Pick your partner wisely.
Pick your partner wisely.
And the scar fades extremely well.
That's it. Thigh lifts, it's a niche procedure, only 10,000 done. In comparison, 120,000 facelifts last year, and then in comparison, probably 500,000 lipo cases, 500,000 breast augmentation cases. So it's not a common procedure. It's more common now because of bariatric surgery, weight loss surgery. We have a great episode on that with Dr. Matt Metz and actually a patient. That's one of my favorite episodes. We haven't talked about that in a while.
Our weight loss patient.
A weight loss patient, yeah.
Lost weight on her own twice, lost 100 pounds. Amazing patient. If you're just looking for an inspirational podcast to listen to, go look up the one on weight loss, because her story is amazing. Even if you have no weight to lose, it's a really awesome interview.
Right.
It's very, very good.
So I think it's more common these days, but it's still a niche procedure. And I think the main reason that is that you have to reach a certain threshold of presentation in terms of the severity of your problem before you're going to consider doing the surgery. If you're there and you kind of know when you're there.
Yep.
Like people come in, it's not like I'm saying, trying to push them in one direction or another. They kind of know before they come in. And the ones that are on the fence always want me to do some energy-assisted liposuction like Body Tight, which definitely will help. But it's not going to solve the problem, but it definitely helps.
Yeah, and for some people that is enough. So.
That's enough, yeah. And most of the people that are on the fence, I mean, literally, like clinically speaking, not like mentally speaking, like when they come in, I'm looking at them.
Or physically speaking.
Or physically, yeah. So most of those people, if you're kind of in the middle, I wouldn't tell you to do a thigh lift anyways, just because it's too much stuff. If you're past the middle point, it's like a no-brainer, to be honest with you.
Do it.
I mean, if you have the time, there's obviously an expense with these kind of surgeries. It takes me at least a couple hours, so that's going to be a little bit more expensive. But it's worth every recovery minute of being annoyed and having to stand and pee through whatever Amy's strange device that allows a woman to stand and pee through, and to have to take a shower after you go poop because you're concerned that you don't want it to contaminate anything that you've done, and having to deal with drains, and then having to drive funny.
Having to be on all fours in the back seat of a car while
having
someone
to
else
stand,
drives.
having to stand while you eat, all these kind of stuff. It's worth it.
It's
it
worth
really
it.
is.
We've made it sound so good. But
I mean, I feel like we just totally hated on thigh lift, but we're both fans of it.
they're an awesome surgery. It really is. It is a definitive solution to a challenging problem. And if you're a candidate and so inspired, you should absolutely seek it out with a board-certified plastic surgeon. Definitely go to a surgeon who's comfortable with this procedure. Absolutely. So it was good.
That was pretty good.
Yeah. And do squats, ladies. Squats.
Toning.
Yep.
Don't be afraid of putting a little muscle mass on.
Put some weight on that bar.
It's not gonna hurt you. Amy, which we have established before, she does hip thrusting. She does like 800 pounds. She enters hip thrusting competitions locally.
I have an old Volkswagen Beetle that I used to train
You hip
with.
thrust your Beetle?
Yep. Slide underneath there. If you need your tire changed, you don't need a jack. I'll just come hip thrust it up for you.
So I have to say, I'm doing hip thrusting now. It's not going to kill you. It makes me uncomfortable. Every time I do it in the gym, I feel like a weakling. I'm only doing 135 pounds.
No direct eye contact while hip thrusting.
Nope. I even use the cushiony square thing so I protect my midsection. So I've gotten a good, thing going down. But lower extremity workouts, toning is really a big part of the way your legs look. If you're going to do a thigh lift, you really have to also focus on that too. If you're going to invest the money and the time, you should try to do everything you can to make it better. So
yeah, absolutely. Well, you guys should definitely check us out on Instagram. We're at Beauty and the Surgeon Podcast. And on YouTube, if you'd like to watch this podcast, we're at Jason Martin, MD. Please like, comment, and subscribe. Share us with your friends. If you found this episode helpful, please share us with a friend who might as well. We'd love to hear your ideas for future podcasts, so please reach out to us if you have a topic you'd like to hear about or just a question. We had a great episode with a question from a viewer.
Which one was that one?
Tiffany from Ohio.
Oh, I like Tiffany from Ohio.
You assume she was in Cincinnati, right? Or Cleveland? I don't know. What's in Ohio? Corn? Don't let me talk.
I mean, how... Okay.
Thank you so much.
All of our fans in Ohio are like, are you kidding me?
Amy's from a landlocked state.
Yeah, right. You're from Breckenridge,
Yep.
a population 300, okay?
Yep.
By the way, Ohio is a wonderful state. Steve,
He's from Ohio.
and the barman's from there. And
He's
also,
from Wisconsin. He just lives in it.
That's okay. He lives in Lebanon, Ohio. So there's some great things in Ohio. And also in the outskirts of Cincinnati, there's a theme park, and I'm forgetting the name now. But they have some of the best roller coasters around.
Oh, there you go. Go to Ohio and ride a roller coaster.
Go Ohio.
Thanks, everyone.
Thank you.